Hi everyone, this is Rob, and I'm the father of 3 boys, Ian, Connor, and Alistair, who are all diagnosed on the autism spectrum. So we've had many emails and comment requests over the years for people who want to know if they or someone they care about has autism. I'll be showing comparisons of family to help contrast more clearly the differences in autistic people versus neurotypical people. Neurotypical essentially meaning any average person with normal brain function, no mental differences or disabilities. We'll be showing my sons versus their cousins in roughly the same age bracket. This isn't a perfect science, as you'll see my niece in here as well, and females often experience autism a little differently. But I believe this video will still be very helpful. Also, as with all our videos, please do your own research, seek professional opinions, and remember this video is a guideline, not a concrete diagnosis. Number 1. So this first example you're seeing is good eye contact from my nephew, and poor eye contact from my son who has autism. If you have good eye contact, chances are low that you have autism. Generally speaking, people with autism have a hard time making long-term eye contact. It makes them feel uncomfortable. I've heard various reasons why this is so, but for the purposes of this example, just know that if the person in question has good eye contact and isn't looking all over the room, their chances of having autism have significantly decreased. Number 2. Sitting still without fidgeting, rocking, or stimming. If the person in question is generally pretty good at sitting still and being patient, the chances of them having autism are significantly lower. Now, a word of caution here, and I can already hear the keyboards lighting up the comment section. Yes, every child is like a Tasmanian devil at some point and will refuse to sit still. What you are looking for specifically is odd tics, odd muscle movements, excessive hand flapping and finger movement, rocking back and forth repeatedly. And caution, a lot of babies rock back and forth on all fours. That's normal behavior. Also, look for repeating words or sounds over and over again, not in a learning way, but in a stuck behavior kind of way. Now bear in mind, some of these behaviors may not be autism related, but may be related to a different or combined neurological issue, such as Tourette's syndrome or sensory processing disorder. Number 3, hitting all milestones including verbal, walking, reading, fine motor skills, and so on. If your little one is making decent to good progress in the common baby and toddler milestones, again, chances are low they have autism. Sadly, I don't have a lot of video for this portion, and I'd have to go digging through old videos and hard drives to try and find enough, but I think this screen will suffice. Number 4, good social skills, not awkward. If you or a loved one has basic social skills, can make their way through a standard conversation with little sweat, chances are pretty low there's autism in the mix. I'm going to ask my sons and their cousins some basic questions, and you'll be able to see how they react. All right, Donnie, how old are you?
6.
What's your favorite color?
Yellow and pink.
Yellow and pink? What are your favorite things to do?
Pretty much anything fun is right now going on electronics.
Electronics, huh?
Mm-hmm.
What kind of electronics?
Mostly phone.
Yeah? Do you use an iPhone?
iPhone 6.
Nice. What kind of apps do you have on it?
I have no idea.
Alistair, how old are you?
I'm 6.
You're 6?
Yes.
What's your favorite color?
Green.
Green?
Yes.
Can you look at me? What are some of your favorite things to do? You have favorite hobbies, things you like to do?
Yes.
For fun? Can you tell me what those things are?
Things are.
Alistair? I
Yeah.
can't see you. Can you tell me what things you like to do?
Yes.
What are things you like to do? What? I can't hear you, bud. What are some things you like to do?
Go to school.
Go to school?
Yes.
Yeah, what do you like about school?
Kindergarten.
You like kindergarten, but what do you like about school? You like any subjects?
Yes.
Like what? Well, I think you guys get the idea. It's kind of hard to have a conversation with the back of a head.
I'm in green grass.
Yeah, you like grass. All right, Branson, how old are you?
8.
8 years old. What's your favorite color?
Blue.
Blue. What kind of things do you like to do?
Play basketball, coloring, and playing with Legos.
Legos? What are your favorite Lego sets?
Harry Potter ones.
All right, Connor, how old are you?
I'm 10.
10 years old. What's your favorite color?
Light blue.
Ooh, light blue. What are some of your favorite things to do?
Play video games, go to water parks, and play with my family.
Can you speak up a little bit so I can hear you? Sorry,
Play-
it's windy out here.
Play video games, go in the water park, and hang out and play with family.
Yeah? What's your favorite thing about hanging with family?
Well, I think I like playing with them in favorite activity buildings, like Natural Museum of Curiosity.
At the Museum of Curiosity. That's a fun place. Cool. Anything else?
No.
Kyler, how old are you?
9.
What's your favorite color?
Blue.
Blue. What kind of stuff do you like to do?
Go on electronics, play with friends, and play with Hot Wheels.
What are your favorite Hot Wheels cars?
Probably Bugattis.
Ooh, Bugattis. Like the Veyron and the Chiron?
Yeah, I have a red Bugatti up in my room that's like a toy, and it actually like drives and stuff.
That's awesome. All right, Ian, how old are you?
I'm 12 years old, turning 13, and I'm turning 13 this month.
Okay, great. What's your favorite color?
Well, let's see. I like pure shiny blue. I even like pure shiny red. Like maybe blood shiny red.
Okay. And what are some of your favorite things to do?
Sometimes I'd like to do devices when going out's not available. And I even like to go out and get some tasty things. I even like to eat out. And sometimes when I do devices at home, maybe I would hear Skillet.
Number 5, does not react poorly to lots of stimuli. Does you or a loved one act normal in public settings, especially areas that are noisy and have flashing lights or strong smells? Well, if they don't act up in these areas of high sensory input, chances are they don't have autism. Now, this one may be a little tricky, but essentially you need to determine if the person in question is getting fussy from the surrounding climate, or because they didn't get something they wanted, like candy from the checkout stand. Bear in mind that people with autism can throw tantrums too. It's not always a sensory meltdown, but the signs to see an impending meltdown usually relate to a person getting really squirmy, making lots of odd noises like growling, extra fidgeting and stimming, and essentially just looking really uncomfortable in the given situation. If a kid stops from acting up in public if they get what they wanted, then it's a tantrum. I'm not recommending giving into a child's rage-fueled whims. I'm just saying that if you're really uncertain which is which, this is always a good way to check. Just don't make a habit of giving into a tantrum, or your child will throw tantrums constantly. Also, this should be obvious, but I'll mention it to avoid the inevitable comment. Yes, anyone will become cranky in a public setting that's loud, smelly, or has flashing lights if they stay there for far too long. I'm talking about after a few minutes to an hour or two maximum, not half days or full days of being exposed to high sensory input. Well, everyone, I hope this video was helpful. Obviously, there are other signs, and none of these signs are absolute. So please don't overthink things or panic. Again, please seek professional help if you feel there is need for it. We only aim to be helpful in our videos and educate to the best of our knowledge. If you can think of anything we missed, please leave a comment. Thanks, everybody.